And you're live.
I'm like delirious of fillers. Hey guys, no, we're doing some Botox right now. And I'm super excited because I like to show sometimes my patients that already have an arched brow, we don't want to make her more arched. So the goal right now is actually to kind of soften it, just improve the overall look, prevent any fine wrinkles from forming around her eyes or between her brow, and then we're going to do the notorious lip flip. We inject a little Botox on the upper lip and sometimes to the depressor septi, which is muscle right under the nose, to keep it from stopping pulling the nose down when you smile and making your lip fall when you smile.
The lip flip.
Squeeze in as hard as you can. Show everyone those 11 lines. Relax a second. We're going to do a little baby injection. I want to tell you something. We have the smallest needle in the industry now. 33 gauge. Squeeze in. Relax. It's basically a horsehair. It's almost no pain with injection. It's minimal. So we're injecting a little bit, squeeze in, into the muscles here, between the brow, called the glabellar complex. Squeeze in again. Good, relax. And this is going to allow us to just stop the movement in the middle brow, which is going to keep her from forming, squeeze in again, lines between the eyebrows. Relax. Also, what I like to do a little bit, squeeze your nose in for me a little bit, relax. We're just going to do a teeny bit on the bunnies, because when you do the glabella in a strong fashion and you get a drop in the mid-brow, we want to make sure that it doesn't pull down or react and make more bunny lines. So we're going to raise your brow, relax. Raise again, Charity naturally goes high, relax. So we're going to have to come a little laterally, inject a few blebs, few units into each area, minimal in the middle, blend it on the edge, raise up, relax. And then she wants to soften the brow a little bit, so we're going to go a little laterally, just a unit or so to keep those brows tame, is what I call it. Eyes?
Eyes, yes.
I'm delirious. DJ, your forehead wouldn't move for 2 years.
I love it.
Yay.
Smile as big as you can, show everyone those crows. Look at those radiating feet. So what we're going to do is we're going to do a little baby bleb. I call this the matzo ball technique, where you do a large bleb, okay, a big bleb, and then we're going to do, smile again, relax, we're going to go right above, just a small bit, smile again, we're going to go right below, small bit.
So Mikey said, bunny line Botox never works totally on me. Any ideas why?
Well, one, it could be the dosing is not enough. 2, it could be maybe it's not a bunny line issue. Or 3, it may be the Botox. You might have to switch to neurotoxin. Turn a little bit this way, smile as big as you can. You can see that has good movement here, but we need to stop that so she doesn't get those lines. So we're gonna do that big bleb in the middle. And then just a slight bit around. Smile. Good, relax. And then a little bit more. Okay. Perfect. And then lastly, the notorious lip flip, her favorite injection. So here is the trick. You gotta watch it, it's gotta be fast. Okay, do me a favor, purse your lips like you're gonna kiss. We're gonna follow those little whiskers.
What do you call this one more time?
This is called the lip flip.
The lip flip.
So take a look, you guys. There's little whiskers here. Relax. Purse again. 1, 2, 3. Perfect. Little injection. All done. Great job. We just gotta do it fast, quick and fast and the furious right here. Squeeze again, or show us again. Relax. Do that again one more time. We're gonna do a little tap. 1, 2, 3. Little pinch. Very little. Good. And then lastly, what I like to do is do the depressor septi. This one does hurt a little bit or makes you want to sneeze. Take a deep breath in, breathe all the way out, little pinch right in there, perfect, all done. And now we're gonna keep her lip elevated and flipped up so that her top lip shows.
Wow.
So in about 2 weeks, she will show us, and she'll actually, why don't you do some videos and pictures in about 3 days, 7 days, and 14 days.
Will do.
And we'll take a look and we'll see how that all comes to fruition. Show everybody the movement right now. Smile as big as you can. Squeeze in as hard as you can. Raise up as high as you can. And purse your lips as high as you can. Perfect. We could also eventually do chin if we wanted, or do the neckline. With her, I would not Botox her neck because it's going to make her sag more. She has thin skin. So you want to keep her nice and contoured. But those are the places you guys can use Botox Cosmetic.
Two questions.
Yeah.
Where do you inject if you wanted to lift the brow?
If we want to lift the brow, the typical areas would be here and here, and you would avoid doing anything up here because you don't want to drop it. But you could do a heavier mid-brow and leave this alone and inject the eyes and let this come up. Depends on the shape of the brow that you want.
Last question. Do you change your dilution based on the area you're treating?
Dilution doesn't matter, guys. It's all based on units. Units is the same regardless of what dilution. You just have to know your own.
Got
Have
it.
a good night.